Hello, I'm Dr. Girish Rao. What is the treatment which we do? If your biopsy report comes as a positive thing, that means that it is a cancer, then we have to put you into a multidisciplinary team. Today, cancer is managed by multiple prongs, I would say. We have surgery on one hand, then you have radiation and then chemotherapy. And many a times we all discuss the scenario and decide what is the most optimum treatment. Surgery by far for mouth cancer is the most predictable kind of treatment, combined with radiation and chemotherapy following your surgery. The surgery could involve removal of the cancer, giving good margins. If it is involving the jaws, then we may have to take out half or the entire jaw. If it is involving the tongue, then we may have to take again, if it is one side, half the tongue. If it is involving both the sides, then the whole tongue has to be taken out. Similarly, inside mouth, inside the cheek mucosa, if it is there, then we do what's called as a wide excision. And once we resect it, we also have to do a bit of reconstruction. Otherwise, the lost part looks very, very disfigured. The face is very disfigured. So whenever the bone is removed, we take bone from your leg or from your hip or from the rib and then replace the bone. If it is a soft tissue involving the inside of the mouth, or sometimes in advanced cancer, even the cancer can come out into the face. At that time, we may have to take out a large part of the soft tissue, the skin of the face too, along with the muscle and bone. In such cases, the reconstruction is much more extensive, involving both the bone and soft tissue. The soft tissue we generally reconstruct using the skin and soft tissue of the hand, or it could be of the leg or from the chest muscle. These are the areas from which we do reconstruction too. And in this day and age, we are also able to replace the lost teeth by putting dental implants into the leg bone and then giving teeth into the reconstructed jaws. So that is another thing which is very, very advanced in terms of not only resection for taking out the cancer, reconstructing and rehabilitating so that you can function normally, you can chew normally, and you can speak normally. Post surgery, many a times if the cancer is quite advanced, in such cases we might have to consider giving radiation and sometimes even chemotherapy. Now, this is very, very important to reinforce to all my patients that follow-ups is very, very important. In the first year, we see our patient on a monthly basis. On the second year, it is once in 2 months. And from third year onwards, it is once in 3 months. This follow-up is extremely important because many a times you can get recurrences after cancer. That means that the cancer can come back. That's an unfortunate thing. And if it is picked up early, then the treatment is much more lesser and it can be much more predictable in terms of outcomes. So detection of the cancer early is very, very important. So you need to be on regular follow-ups, and it is absolutely important that you come back into our practices so that we can keep a regular tab on how the progress is happening. One of the most important thing is prevention. Even though we have very advanced kind of treatment for cancer, starting from surgery, radiation, chemotherapy, and today immunotherapy, and even in surgery, the reconstruction today, we are able to bring back what has been completely removed to look normal and function normal, doing advanced reconstructive surgeries and advanced implants, which we can even put your teeth back there. Despite all this, unfortunately, many a times cancers do recur. And my message to anybody who has a habit of smoking, a habit of chewing pan masala or gutka or tobacco in any form, it could be in the village side, they have tobacco leaves or tobacco sticks, or if you are drinking excessive alcohol, it is very, very important that you give up your habit. Prevention is any day better than cure. It is important that you basically give up the habit, because if you give up the habit, the possibility of reversing, as I said earlier, mouth cancer, you can have something called as a pre-cancer. You can have a white patch, you can have a red patch. White patch is called as leukoplakia, red patch is called as erythroplakia, and the entire mouth can become very stiff. and that's called as submucous fibrosis. These are precancerous conditions. And if somebody has this and they're still having the habit, 100% you would go and get cancer in a few months or few years down the line. So it is important that you give up the habit. And if you give up the habit and come for regular follow-ups, then we can reverse the entire process and get your mucosa to almost normalcy. Also important, if you have ever had these habits, it is important that you go for regular checkups, what we call today as oral cancer screening. This is important because cancer, if it is detected early, can be fully cured. Before it is spread into the neck or different parts of the body, if we pick it up in the initial stages, then it's completely curable. Advanced cancer, the outcome is unpredictable. The chances of the cancer coming back is higher when it is spread into the neck or it has gone into other parts of the body. So it is important that we detect cancer early. And I'm trying to reinforce that prevention is very important, and also detecting it. Early intervention and early detection is very, very vital for getting better outcomes.